All right, now we're going to do the active and passive range of motion for the knee. So flexion and extension, we're going to do supine, and internal and external rotation, we are going to do seated. So when we do the order of this, we're going to do flexion, extension, active first, and then we're going to do active for internal and external, and we're going to do passive for internal and external, and then passive for flexion and extension. So if you can lay facing up, down here. So I will do on the left leg here. You're going to have the reference arm going up the side of the leg here, or the thigh, and having the center at the knee. And then we're going to have you bend your knee. You can flex your hip a little, and then keeping it in the middle of the lower leg here. So this range is roughly 130 degrees, and come back straight back out.
And then make sure to ask for pain.
Yes. And then extension, can you straighten your leg? So just a few degrees here, and any pain with that. So you do flexion, extension on one leg, and then do the other leg. So now if you could be seated, please. All right, for internal and external rotation, you are going to place the goniometer on the top of the knee here. Your reference point is going to be the tibial tuberosities. She doesn't really have any, so I'm going to be doing it on the front of her leg here with her scars. So you're going to have her externally rotate the leg out here. It's going to be a small amount. This is like roughly 10 degrees, and then if you could rotate your lower leg in, so that's about 5 degrees or so, and then you would do the other leg. So now we're going to do passive range of motion, and we're going to have you rotate your leg out there. Any pain with that? Can I go further? Any pain there? All right, now we're going to internally rotate. Any pain there? Can I go further? Any pain there? All right, and then I would do the other leg, and now we're going to go face up again. All right, bend your knee here. Get out of the way. All right, any pain there? Can I go further?
Yep.
Any pain there? Yep. So you want to lift up the foot a little bit so there's not a lot of friction, and it will be a little bit easier to flex. So now we're going to do extension, so you can put your hand underneath, push down a little, not too hard, and just lift up here. Any pain? Yep. Can I go further? Yep. Any pain there? Yep. All right. And make sure to note the end feel that you do feel here. There is a key at the bottom, so just in case if you forget what the codes are. All right, so that's the active and passive range of motion for the knee.